You know that feeling, right? You're standing in the pharmacy aisle, maybe wrestling with a stubborn headache or a cough that just won't quit, and you're faced with this just overwhelming wall of choices. Hundreds of bottles, each promising relief. But like, how do you even start to pick? How many different versions of cold and flu medicine can there possibly be?
It's a lot.
It's not just confusing, it can feel downright intimidating, honestly.
Okay, let's unpack this a bit. We often grab a pain reliever, maybe a cold medicine, or something for heartburn. They seem like such simple everyday solutions.
Sure, the go-tos.
But what if these remedies, the ones that are so readily available, hold hidden complexities, maybe even dangers that we're just not aware of? What if really understanding them, like at a professional level, could dramatically change how you approach your own health?
Well, what's fascinating here, I think, is that the very accessibility of these products, it can create a profound and often kind of false sense of security.
Right. Easy to get, must be safe. Exactly. Because they're so easy to buy, often without even needing a doctor's visit. There's this widespread, almost unconscious perception that they're entirely benign, that they couldn't possibly do much harm. But, well, that couldn't be further from the truth sometimes.
Okay.
So today we're doing a deep dive into these over-the-counter agents. We want to explore their therapeutic potential, what they're actually designed to do for you, but maybe more importantly, their toxic potential, how they can actually harm you if not used correctly. Our goal here is really to equip you with the deep, nuanced understanding that, truly informed consumers, frankly, even healthcare professionals, need when navigating this whole landscape. It's about getting that expert-level insight.
Exactly. Our mission in this deep dive is to cut through that sea of confusion, to really uncover the essential facts, and to arm you with the knowledge to navigate the OTC market with, like, the precision and understanding of an expert. We're going far beyond just the surface labels, peeling back the layers to truly understand what's inside those bottles, how those specific ingredients can interact with your unique body, and why that knowledge is absolutely critical.
It really is.
Because when it comes to your health, being genuinely informed isn't just, a preference. It's a profound necessity, especially in this era of self-care where we're encouraged to manage more ourselves.
Absolutely.
So let's begin by defining our terrain here. This massive and often, let's face it, perplexing world of over-the-counter medications.
Okay.
In the United States, medications are legally categorized into two main classes. First, you've got prescription medications. These require a specific order from a licensed healthcare provider, your doctor, nurse practitioner, etc.
Right, the Art-Bex ones.
Exactly. Second, you have non-prescription or over-the-counter OTC medications. Now, these are drugs that the Food and Drug Administration, the FDA, has determined have clear enough directions for safe use that theoretically the general public can understand them without direct medical supervision.
Okay, that's the key distinction, no doctor needed, theoretically.
Right. And it's absolutely crucial here to distinguish OTCs from dietary supplements. That includes things like vitamins, minerals, maybe herbal remedies, botanical products.
Yeah, that's a whole different ballgame.
It really is. Those fall under an entirely different regulatory framework, often treated more like food products than drugs. And that distinction, well, that's probably a whole other deep dive for another day.
Definitely.
But for our purposes today, when we talk about OTCs, we're discussing regulated drugs intended to treat specific identifiable medical conditions.
Got it.
And the sheer scale of this market, this whole industry built on self-care, is truly staggering. Just consider this. In 2022 alone, consumers in the U.S. spent an estimated $41.2 billion on OTC products.
Wow. Billion with a B.
$41.2 billion, all for self-managing a huge variety of acute conditions, like, the common cold, or even chronic ones, like ongoing heartburn or persistent pain.
That number really tells a story, doesn't it? It shows how deeply integrated these products are into our daily lives and health routines.
Absolutely.
And that massive scale, combined with the, let's say, sophisticated ways these products are marketed, often creates what we could call the illusion of choice.
Explain that.
Well, you walk down that pharmacy aisle, right? And you might see what feels like an endless array of options for, say, just a common headache.
Rows and rows of them.
Exactly. But the reality is, while there are over 100 different systemic analgesic products, that's pain relievers you take by mouth, available, if you were to meticulously dig into the active ingredients,
Which most people don't.
which most people don't have time for or maybe don't realize they should, you'd find that almost all of them contain just a few core compounds, maybe aspirin, acetaminophen, or one of the non-steroidal anti-inflammatory drugs, the NSAIDs like ibuprofen or naproxen, or maybe a combination.
So the core medicine is often very similar.
Very similar. The perceived differences, the reasons one bottle might seem totally different from another, often come down to what you might call questionable ingredients added to these core formulas.
Like what?
Well, for example, you'll find pain relievers with added caffeine, which is a stimulant, or antihistamines, which are actually designed to cause drowsiness, even though neither of those directly treats the pain in the same way the main analgesic does.
Huh. So they're adding things for side effects, almost, or other perceived benefits.
Sometimes, or to create a specific product niche. It's a remarkably clever marketing maze, isn't it?
It really is.
Yeah.
Beyond those often unnecessary added ingredients, you see how brand names are meticulously crafted. They're chosen to imply a very specific use or strength.
Oh, absolutely.
You see labels splashed with migraine relief, arthritis pain, maximum strength, nighttime formula.
Those words are powerful triggers.
Incredibly powerful psychological triggers. They subtly guide our choices, often making us believe one product is inherently superior or more precisely tailored to our specific need than another, even if the primary active ingredients are, chemically speaking, pretty much identical.
And then you layer on the special dosage formulation.
Right. Tell us about those.
Well, you've got enteric-coated tablets, supposedly to protect your stomach, gel tabs, promising faster absorption, convenient liquids, orally disintegrating strips or tablets that just melt on your tongue.
The fast melts, yeah.
Sustained release products, engineered for longer action, powders you mix, even seltzers that fizz up.
Okay, so lots of delivery methods.
A ton. And each of these features, these little innovations in delivery, typically comes with a higher price tag.
Naturally.
Yet, in many, many instances, a less expensive generic product containing the exact same core active ingredient in the same dose can be just as effective and just as safe. So what you're often paying extra for is the packaging, the branding, maybe the perceived convenience.
Rather than a fundamentally better medication.
Precisely. If we connect this to the bigger picture, this isn't just about clever marketing in isolation. It's about how product design and advertising can, whether intentionally or not, obscure critical pharmacological information.
Right, making it harder to see the core facts.
Exactly. This leaves consumers vulnerable, making choices based more on perception, maybe brand loyalty, advertising hype, rather than on solid pharmacological fact. The sheer volume of options, combined with those often subtle, maybe even irrelevant distinctions between them, just means that consumers are generally overwhelmed and confused when they stand in that aisle.
I can definitely relate to that feeling.
And in that state of overwhelm, what do most of us tend to do?
Grab the one you recognize. Or the one on sale.
Pretty much. You default to the products that are most heavily advertised, the ones you recognize from TV commercials or those big end cap displays, often without taking the time to fully understand what's actually inside the bottle, or if it's truly the best, safest, or most cost-effective choice for your specific health needs. And this really highlights a fundamental gap in consumer literacy when it comes to these common products. We think we know them, but maybe we don't know them as well as we should.
That brings us to a really fascinating and, frankly, incredibly important evolution in this whole OTC landscape, the RX to OTC switch process.
Yes, this is critical.
Since 1976, the U.S. Food and Drug Administration, the FDA, has been involved in what is, by all accounts, a very rigorous process of converting certain prescription-only medications to over-the-counter status.
And rigorous is the key word. It's not taken lightly.
Not at all. This isn't some quick or easy rubber-stamping decision. The core criteria for a drug to even be considered for a switch are exceptionally stringent.
What do they look for?
Well, products must be judged by expert review panels to be, quote, generally safe and effective for consumer use without medical supervision.
Okay. Safe and effective without a doctor's input.
Right. And a crucial prerequisite, maybe the most important one, is that you, the consumer, must be able to reliably self-diagnose and safely treat the condition without needing direct oversight from a doctor or other healthcare professional.
That's a high bar for many conditions.
It is. And as you can imagine, navigating this whole regulatory pathway is both costly and rigorous for the pharmaceutical manufacturers. It requires extensive research, clinical trials, tons of data to prove public safety for self-use.
And the impact of these switches, these carefully considered decisions, has been truly significant. It's dramatically enhanced and expanded self-care options for millions of consumers over the decades.
How many are we talking about?
Think about this. Today, over 100 active ingredients or specific drug formulations that are available over the counter were previously accessible only by prescription.
Wow, over 100.
Yeah. This allows people to manage common ailments more easily, often more quickly, and frequently more affordably, without needing a doctor's visit just for, common, well-understood conditions.
Right, saves a trip to the doctor for something straightforward.
Exactly. And just recently, in 2023, we saw two particularly impactful switches, each with pretty profound public health implications.
Okay, what were they?
First, naloxone nasal spray was approved for OTC use.
Naloxone. That's the opioid overdose reversal drug, right?
That's the one. It's a critical medication specifically designed for the emergency management of known or suspected opioid overdose, making that widely available, accessible without a prescription. That's a major, potentially life-saving step forward in addressing the ongoing opioid crisis.
Huge implications there. What was the second one?
The second was norgestrel, which is a progestin-only oral contraceptive used for the prevention of pregnancy.
Ah, an OTC birth control pill.
Essentially, yes. This was also approved for OTC use, and this has significant implications for reproductive health access, putting more control directly into the hands of individuals seeking to prevent pregnancy, removing barriers like needing a prescription.
Two really big examples just
Yeah.
from last year. And what's really important to understand, I think, is that the FDA isn't just mindlessly rubber stamping every drug that comes along asking for a switch. They're constantly evaluating new candidates for potential switches. Right? Always weighing the benefits of increased access against the potential risks.
Absolutely. It's a continuous process. For example, you have drugs like sumatriptan, which is a medication for migraine headaches,
That's 10, yeah.
and various nicotine replacement therapies, things like oral inhalers, nasal sprays, even varenicline, which is Chantix, for smoking cessation.
Okay.
All of those are examples of ongoing considerations, drugs being evaluated for potential future OTC reclassification.
But here's where it gets really interesting, I think, and where we can learn a lot about the FDA's balancing act. It's looking at the no's,
Yeah.
the medications that were denied OTC status.
Exactly. The denials are incredibly illuminating. They show the careful boundaries the FDA tries to maintain between public access and public safety.
Give us an example.
Okay, let's look at cholesterol-lowering agents, specifically the statin drugs like lovastatin and pravastatin. These were denied OTC status, and for a very important reason.
Why was that?
Well, hyperlipidemia, or high cholesterol, is a chronic condition. It's often asymptomatic, meaning you don't typically feel any symptoms.
Right, you don't feel high cholesterol.
You don't. But it has potentially life-threatening long-term consequences like heart disease and stroke. The FDA Advisory Committee determined that managing high cholesterol absolutely requires, quote, diagnosis and ongoing management by a healthcare professional.
Makes sense.
A consumer simply cannot easily self-diagnose high cholesterol or safely adjust their treatment based on symptoms alone because, well, there usually aren't any symptoms to guide them.
Okay, that's a clear case. Any others?
Yeah, similarly, oral acyclovir, that's an antiviral medication used for recurrent genital herpes. It was not approved for OTC use.
What were the concerns there?
The primary concerns revolved around the potential for misdiagnosis and inappropriate use. If people self-diagnosed incorrectly or used it when not needed, it could potentially lead to increased viral resistance to the drug over time.
Ah, the resistance issue. That's a big public health concern, too.
Huge. So the FDA in these instances is weighing the potential benefits of easier access against these very real, potentially widespread public health risks of misdiagnosis, improper use, development of drug resistance. It's a delicate tightrope walk, absolutely. And these denials really demonstrate a profound commitment to putting consumer safety first.
It really is a delicate tightrope walk.
Yeah.
And just to give everyone listening a better sense of the sheer range of conditions that are now treatable over the counter because of these careful switches over the years, let's maybe look at a few diverse examples from the FDA's list, say between 2006 and 2023. Just to illustrate the breadth.
New idea.
Okay, so we have adapalene. That's a topical retinoid. It was originally a prescription-only acne treatment.
What's like different?
Exactly. But now it's widely accessible over the counter for general skincare and acne management. Then there's azomprozole, one of the proton pump inhibitors, or PPIs.
The acid reducers.
Powerful acid reducers, yeah. They moved to OTC status for frequent heartburn relief. People know Nexium 24HR, for example. And diclofenac, which is a topical NSAID gel. That became available for localized arthritis pain, offering an alternative to taking oral pain relievers like ibuprofen all the time.
Voltaren gel, that one.
That's the one. Even something as seemingly simple as polyethylene glycol, which is an osmotic laxative, like Miralax, switched over for constipation relief, providing a really effective and generally gentle option, even for chronic use sometimes.
Yeah, quite a variety.
It really emphasizes the vast breadth, doesn't it? From skin issues and digestive health to localized pain management and, like we mentioned earlier, even critical emergency care like naloxone. All successfully transitioned to self-care options, but under this very meticulous FDA oversight. This is really foundational knowledge if you want to navigate this space like an expert.
Absolutely foundational.
Now, you might be listening and thinking, okay, this is interesting background, sure, but why does mastering this detail matter so much to me beyond just, picking a product for my next cold?
Fair question.
Well, this brings us to the really critical role of awareness. A role that is absolutely essential for clinicians, yes, but frankly, for all of us as consumers navigating our own health. There are 3 deeply important reasons why it's vital to be intimately familiar with this whole OTC class of products.
Okay, let's hear them.
First, and this is a positive point, many OTC medications are genuinely effective and safe when used properly for treating common, often self-limiting ailments.
Right, they serve a real purpose.
Definitely. For healthcare professionals, being able to confidently recommend safe and effective OTC treatments can be a huge benefit to patients, especially considering that health insurance often doesn't cover these medications, right? So it encourages more cost-effective self-management.
Empowering patients, essentially.
Exactly. It's about empowering patients to make informed, beneficial choices for their everyday health needs.
But
There's always a but. The second and third reasons are where the rubber really meets the road regarding safety and where serious risks can emerge, sometimes unexpectedly.
Okay, what's number 2?
Second, and this is a major concern that I think many people overlook, many active ingredients found in common OTC medications can actually worsen existing medical conditions you might have. Or they can interact dangerously with prescription medications you might already be taking.
Ah, the interaction piece.
Yes. This is where seemingly benign choices made casually in that pharmacy aisle can have serious, even potentially life-threatening consequences without you even realizing it at the time.
Right, that's serious. And the third reason.
And finally, the misuse or outright abuse of certain OTC products can lead to very significant medical complications.
Abuse of OTCs.
Unfortunately, yes. Let me give you a few stark, real-world examples that really illustrate these dangers clearly. Take phenylpropanolamine, for instance. PPA.
Okay, what was that? This was a common sympathomimetic, basically a type of decongestant and appetite suppressant that was once widely found in many, many cold, allergy, and even weight control products here in the U.S.
I remember seeing that ingredient years ago.
You probably do. However, it was ultimately withdrawn from the U.S. market by the FDA because comprehensive reports indicated it significantly increased the risk of hemorrhagic stroke.
Stroke from a cold medicine ingredient.
Yes, a devastating type of bleeding in the brain. Imagine that something once so common, available everywhere, now recognized as posing a serious danger. It really underscores how our understanding evolves.
Wow. Okay, that's a serious historical example. What about things currently on the shelves?
Well, the alarm bells ring even louder with some other widely available products. Consider dextromethorphan, or DXM as it's often abbreviated.
The cough suppressant.
Exactly. It's a very common antitussive found in a vast number of cough and cold preparations. Its legitimate use, when taken as directed, is generally safe and effective for quieting coughs. However, it's unfortunately also a substance that is sometimes abused, particularly by adolescents. They might consume it in very high doses. We're talking maybe 5 to 10 times the recommended therapeutic amount.
Why would they do that?
To achieve a dissociative or hallucinogenic effect. Sort of an out-of-body feeling or altered perception.
Okay.
Now, here's the absolutely crucial point that often gets missed in these situations. While severe complications from DXM alone in an overdose are relatively uncommon, Many of the OTC products containing DXM are actually combination products.
Ah, back to the hidden ingredients.
Precisely. They often include other active ingredients like acetaminophen, the pain reliever,
Tylenol.
antihistamines like diphenhydramine, which cause drowsiness, or sympathomimetics like decongestants such as phenylephrine. And those additional ingredients, particularly acetaminophen, can be absolutely lethal in overdose quantities.
So someone abusing the DXM product might unintentionally poison themselves with the other ingredients.
Exactly. In many tragic cases, it's often not the DXM itself that causes the fatal outcome, but the hidden, unsuspecting ingredients that were part of the same bottle, taken in massive quantities along with the DXM.
That is incredibly concerning. Any others like that?
Then there's loperamide. Most people know it by its common brand name, Imodium AD.
For diarrhea, right?
Yes, an effective antidiarrheal agent. In appropriate recommended doses, it's very safe and works well. However, in very large, supratherapeutic doses, meaning doses far exceeding what's recommended on the label, it's unfortunately used illicitly by some individuals, either to try and create an opioid-like high, because it interacts with opioid receptors in the gut, or sometimes to self-treat the excruciating symptoms of opioid withdrawal when they can't access opioids.
Trying to use an OTC to manage withdrawal.
Yes, and the severe risks associated with this kind of abuse are profoundly alarming. We're talking about altered mental status, life-threatening respiratory depression, where breathing slows down dangerously, and extremely dangerous ventricular arrhythmias.
Heartburn.
Yes, including a specific and very dangerous type of irregular heartbeat called torsades de pointe, which can spiral into sudden cardiac arrest.
Wow. From an antidiarrheal medicine.
In massive overdose quantities, yes. And let's not overlook pseudoephedrine.
The decongestant we talked about earlier.
Right. Highly effective decongestant, widely used in cold preps. But it also has that dark side. It's a key precursor ingredient used in the illicit manufacture of methamphetamine.
Right, the meth connection.
Because of this, very strict federal regulations were put in place years ago. Now, pseudoephedrine is available only from locked cabinets or from behind the pharmacy counter.
Yeah, you have to show ID and sign for it.
Exactly. Its purchase is subject to quantity limits, and it requires photo identification. This whole situation really raises an important question for all of us, doesn't it? When we talk about self-care and the incredible accessibility of these products, how much responsibility truly falls on the individual consumer to understand these really intricate complexities?
Versus the system.
Right, and how much responsibility falls on the system, the manufacturers, the regulators, the pharmacists, to make this critical safety information clearer, more unavoidable, perhaps. The information, especially on that drug facts label we'll talk more about, is technically there.
But is it getting through?
But access to information doesn't always automatically equal understanding or, crucially, application of that knowledge.
That question really cuts to the core of the problem, doesn't it? And to truly illustrate just how critical this understanding is, this ability to master the hidden risks like a professional, maybe we should dive into a specific case study, a scenario that unfortunately plays out in emergency departments far too often.
I think it'll be very helpful. Let's do it.
Okay, let's talk about AH. We'll call him AH. He's a 58-year-old male. He arrived at the emergency department presenting with a pretty deeply troubling set of symptoms. He was confused, suffering from severe abdominal pain, experiencing nausea, and he had new onset flu symptoms that had been lingering for several days.
Okay. Sounds generally unwell, but the confusion and severe abdominal pain are red flags.
Definitely. His past medical history included hyperlipidemia, that's high cholesterol, and bilateral knee osteoarthritis, a chronic pain condition affecting both his knees.
All right, so likely on some meds for those.
Correct. For his chronic knee pain, he had been regularly taking Tylenol arthritis pain. That contains 650 milligrams of acetaminophen per tablet. His dose was 2 tablets, 3 times daily.
Okay, let's calculate that. 2 tabs, 650 milligrams each, 3 times a day. That's 1,300 milligrams times 3. 3,900 milligrams of acetaminophen daily just from his arthritis medicine.
Exactly, 3,900 milligrams daily. He also took a torvastatin, which is a statin medication for his cholesterol.
Okay, so a significant baseline acetaminophen dose already, right near the typical OTC med.
Right near the max. Now, here's precisely where the over-the-counter products dramatically entered the picture for AH. For the past 3 days, trying to combat his flu-like symptoms, AH had been taking 2 very common over-the-counter medications.
Okay, what were they?
Alka-Seltzer plus cold and flu day, at a dose of 2 gel caps every 4 hours during the day, and Alka-Seltzer plus cold and flu night, 2 gel caps taken at bedtime.
Ah, the combination cold products, and likely containing more acetaminophen.
Bingo. Adding another layer of complexity, his social history indicated that he regularly consumed about 3 shots of bourbon every single night.
Okay, so chronic alcohol use on top of high baseline acetaminophen plus adding more acetaminophen from cold meds. This is setting off major alarm bells for liver toxicity.
Precisely. Upon his arrival at the emergency department, his vitals, temperature 99.8 degrees ARF, blood pressure 1,364, pulse 78, respiratory rate 15. On physical exam, the medical team found left upper abdominal tenderness pain when they pressed there.
Near the liver and stomach.
Clear evidence of hepatomegaly, that's an enlarged liver, and mild sclerolicterus, which is that noticeable yellowing of the whites of his eyes.
Jaundice, a classic sign of liver problem.
Exactly. But most critically, his laboratory data came back, revealing critically elevated liver enzymes. His ALT was an astonishing 557 IUL.
Whoa. Normal is like under 35-40 usually.
Way high. His AST was 485 IUL.
So extremely high.
And his bilirubin level was 2.9 milli-GDL, drastically elevated from a normal range typically below 1 or 1.2.
Yeah, those numbers are stark, undeniable markers of severe acute liver damage happening right now.
So what does this terrifying picture mean for AH, and how does it connect back so directly to our everyday topic of OTCs? This is precisely where that hidden part of over-the-counter medications becomes incredibly dangerous.
Right, because people don't think of their cold medicine as containing the same drug as their pain reliever.
Exactly. When you look at these popular cold and flu medications, they typically aren't single-ingredient products, are they?
No, almost never. They're formulated to hit multiple symptoms at once.
Right. They'll often include an analgesic for pain or fever, like acetaminophen or maybe aspirin, an antihistamine for sneezing or runny nose, an antitussive for cough, maybe an expectorant to loosen mucus, and often a nasal decongestant. It's a cocktail.
A cocktail where you might not know all the ingredients or their doses?
Precisely. In AH's case, his chronic use of Tylenol arthritis pain was already contributing that substantial 3,900 milligrams of acetaminophen daily. As you said, very close to the recommended maximum for over-the-counter use in a 24-hour period, which is generally cited as 4,000 milligrams, though some labels now recommend lower, like 3,000 or 3,250 milligrams.
Okay, so he was already pushing the limit just with his baseline pain med.
Pushing the limit. But then you add in the cumulative impact of those additional OTC cold and flu products he started taking for his flu symptoms.
Let's break it down.
Okay, each dose of the Alka-Seltzer plus cold and flu day contains 650 milligrams of the acetaminophen per 2 gel caps. And he was taking that roughly every 4 hours during his waking day. Let's say he took it 4 times during the day. That's another 2,600 milligrams.
Okay, so 3,900 plus 2,600, we're already at 6,500 milligrams.
And then the Alka-Seltzer plus cold and flu night product also contains 650 milligrams of acetaminophen per 2 gel caps, which he took at bedtime, at another 650 milligrams.
So 6,500 plus 650, that's 750 milligrams of acetaminophen in a 24-hour period.
Yeah. When you meticulously calculate the cumulative dosage, it becomes frighteningly clear that AH was highly likely ingesting somewhere between 6 to 7 grams, that's 6,000 to 7,000 milligrams of acetaminophen daily over those past 72 hours.
That is well above the recommended maximum, even under direct medical supervision, let alone for casual self-care. That's deep into the danger zone for liver damage.
Deep in the danger zone. And then you have to factor in his chronic alcohol use. AH's regular consumption of those 3 shots of bourbon every night didn't just add another insult to the liver, it significantly potentiated the risk for acetaminophen hepatotoxicity.
Right. Explain how alcohol does that.
Well, chronic alcohol consumption fundamentally changes how your liver metabolizes acetaminophen. It induces certain liver enzymes, specifically one called CYP2E1, which converts more of the acetaminophen into a toxic byproduct called NAPQI. Normally, your liver can neutralize small amounts of NAPQI with something called glutathione.
But with high doses of acetaminophen and chronic alcohol use, you overwhelm that system.
Exactly. You deplete your glutathione stores much faster, and the toxic NAPQI builds up, causing direct damage to liver cells. So the alcohol makes the same dose of acetaminophen much more dangerous.
It's a deadly combination.
It really is. This devastating, unwitting combination, a high cumulative dosage of acetaminophen, often hidden across multiple seemingly benign products, compounded by chronic alcohol use, led directly to AH's acute liver failure.
And tragically, as national data shows, unintentional acetaminophen overdose is a leading cause, maybe the leading cause, of acute liver failure in the United States. It's a real and present danger, often stemming from exactly this kind of scenario.
It's a stark, almost horrifying reminder of the warnings that are actually clearly stated on all over-the-counter acetaminophen products. These are warnings mandated by the FDA.
What do they typically say?
The labels explicitly state that severe liver damage can occur if consumers do three key things. One, take more than 4,000 milligrams of acetaminophen in 24 hours, or sometimes less, as we noted.
Okay.
Two, use acetaminophen concurrently with other drugs that also contain acetaminophen.
The combination product issue.
And three, take acetaminophen and drink 3 or more alcoholic beverages daily.
So the warnings are there, covering exactly what happened to AH.
They are there. These warnings are not just, legal boilerplate. They're there for a profoundly important reason. But, unfortunately, and this is the fundamental problem we really aim to address in this deep dive, many consumers just do not carefully read OTC medication labels.
Or they read it once, maybe years ago, and assume the product hasn't changed.
Right. And even more broadly, many simply do not appreciate the sheer amount of acetaminophen that can be hidden in various seemingly unrelated over-the-counter products they might be taking simultaneously for different symptoms.
Yeah.
This truly is the core aha moment for you, the listener. That common cold remedy, seemingly innocent, might be packing a potent dose of the exact same drug you're already taking for your arthritis pain, without you even realizing the cumulative and potentially fatal burden you're placing on your liver. Mastering this isn't just smart. It's essential self-preservation.
Absolutely. Which leads us naturally to, how do we become that savvy, expert-level OTC consumer?
Exactly. After hearing AH's story and really understanding these very real dangers, it's probably crystal clear that becoming a savvy, expert-level, over-the-counter consumer isn't just about, saving a few dollars on generics. It's fundamentally about protecting your health and your well-being.
It's risk management for your own body.
Perfectly put. If you take one single actionable thing from this entire deep dive, please let it be this. Your new best friend, your essential guide in that bewildering pharmacy aisle, is the drug facts label.
Not the flashy front panel, but the detailed back or side panel.
Exactly. This isn't just a suggestion. It is an FDA-required component of all over-the-counter medication packaging. It's specifically designed to give you all the critical information you need to make informed choices. It has a very specific, standardized format for a reason, to make it as clear and easy to understand as possible if you just take a moment to look.
Okay, walk us through what's on that standard label. What should people look for?
All right. That label, often formatted in a clear grid or box, must include several key components presented in a specific logical order. First, right at the top, you'll find the active ingredient or ingredients along with the exact amount per dosage unit, like per tablet or per 5 milliliter of liquid.
Okay, number one, what drug is actually in it and how much? Crucial.
Absolutely fundamental. Second, it lists the purpose of the product. This tells you its pharmacologic action, what it actually does in your body. For example, it might say pain reliever, fever reducer, antihistamine, nasal decongestant.
So what category of drug it is?
Exactly. Third, it clearly states the use or uses for the product. These are its indications what specific conditions or symptoms it's intended to treat. It might say, for temporary relief of headache, muscle aches, or temporarily relieves runny nose and sneezing.
What it's supposed to help with. Got it.
Fourth, and this section is absolutely vital, are the specific warnings. This is where you find the really critical safety information.
This is the part people often skip, maybe.
I suspect so, but it's so important. This is where you'll learn when the product should not be used, like if you have certain medical conditions. It includes critical pregnancy or breastfeeding information. It tells you when you should stop using it and seek professional medical care, like if symptoms worsen or last more than 7 days. It lists potential side effects. And crucially, it lists other substances or activities to avoid while taking the medication, things like avoiding alcohol or being cautious when driving.
A lot of critical info packed in there.
A ton. Following those warnings, you'll find precise dosage instructions, when, how, and how often to take the medication. This is often presented in a clear, easy-to-read table format, especially when there are different doses recommended for different age groups or populations.
So exactly how much to take and how often.
Right. Then it also lists all the inactive ingredients. This can be very important information for people with allergies or sensitivities to things like dyes, gluten, lactose, or specific fillers or binders used in the tablet or liquid.
Good point. Sometimes the inactive stuff causes problems too.
It can. Finally, there's usually other information, like specific storage instructions, keep in a cool, dry place, etc.
Okay, pretty comprehensive.
It is, and the FDA even mandates specific readability guidelines for these labels. They require a reasonably large type size, typically greater than 6-point font, for the main information, and clear formatting, like using solid square or circle bullets, to make it as easy as possible for you to quickly scan and digest this critical information. It's truly designed to empower you if you use it.
Yet, despite all these thoughtful efforts by the FDA to standardize and clarify, that hidden ingredients problem persists, as we saw so tragically with AH. Many common and potentially problematic ingredients can still be tucked away in products where you might not logically expect them, making reading that label every single time absolutely paramount.
So true. Let's look at some specific examples of these hidden ingredients across different common OTC classes. Where else do things pop up unexpectedly?
Okay, well, alcohol, for instance. You obviously expect it in alcoholic beverages, but it's actually a common ingredient in many liquid cough syrups and cold preparations, often used as a solvent or preservative.
Really? Like which ones?
Well, looking at some common examples, Theraflu Express Max Liquid contains 10% alcohol. Vicks NyQuil Cold and Flu Liquid, the classic one, also contains 10% alcohol. Even some mouthwashes, like the original Listerine antiseptic, can contain up to 26.9% alcohol.
Wow, 10% sounds like a glass of wine almost.
Yeah.
And 27% is significant.
It is, and this is profoundly crucial information if you're taking other medications that interact negatively with alcohol, like metronidazole, an antibiotic, or certain sedatives,
No.
or if you have specific medical conditions like liver disease where alcohol should be avoided, or obviously if you're in recovery from alcohol dependence.
Absolutely critical to know.
What else? Then there are antihistamines. You naturally expect to find them in allergy medications, right, like Claritin or Zyrtec, but they're frequently hidden as the sedative ingredient in many combination analgesics, like Advil PM or Tylenol PM. The PM stands for the antihistamine, usually diphenhydramine, added to help you sleep while it relieves pain.
So the sleepiness isn't just a side effect. It's an intended effect from a hidden ingredient.
Exactly. They also show up sometimes in menstrual products aimed at relieving multiple symptoms, like Middle Complete, and certainly in dedicated over-the-counter sleep aids like Nitol or Unison sleep tabs, where diphenhydramine or a similar antihistamine is often the only active ingredient.
Okay. And the risk there is mainly drowsiness.
Primarily sedation, yes. Drowsiness, impaired coordination. And this can be significantly compounded, made much worse, if you combine these products with other central nervous system depressants, prescription sedatives, tranquilizers, opioids, or, again, alcohol. Very important interaction potential.
Got it. Keep going. What else is hiding?
Aspirin and other salicylates show up in unexpected places, too. Beyond regular aspirin tablets, they're a key ingredient in some effervescent antacids, like original Alka-Seltzer.
Alka-Seltzer has aspirin. I didn't know that.
The original formula does, yes. Salicylates are also found in antidiarrheals, such as Pepto-Bismol, that's bismuth subsalicylate, and sometimes in certain menstrual products.
And why is that important to know?
Well, this is a very big deal, especially for children or teenagers recovering from viral infections like the flu or chickenpox, because of that rare but very serious risk of Rey syndrome we mentioned, the potentially fatal condition affecting the brain and liver.
Right. No aspirin or salicylates for kids with viruses.
Correct. It's also critical information for adults who have bleeding disorders, stomach ulcers, or who are taking prescription blood thinners like warfarin because aspirin increases bleeding risk.
Okay. What about caffeine?
Caffeine is another incredibly common hidden ingredient. Beyond the obvious places like caffeine pills or energy drinks, it's often included in many combination analgesics, particularly those marketed for headaches or migraines like Excedrin Extra Strength or BC Powder. It's also sometimes found in menstrual products like Midol.
Why add caffeine to a pain reliever?
It's thought to potentially enhance the pain-relieving effect of the analgesic slightly, and also helps combat drowsiness sometimes associated with pain or other ingredients. But while a little caffeine might seem harmless...
Too much isn't good.
Exactly. Excessive intake across different products can lead to insomnia, nervousness, jitters, rapid heartbeat, and it can also cause those dreaded rebound headaches if you use caffeine-containing pain relievers frequently and then suddenly stop. Your body gets used to it.
The caffeine withdrawal headache. Yeah. Okay, what else? Sodium.
Sodium, yes, often overlooked, but it can be a significant hidden component, especially in effervescent formulations, the fizzy tablets.
Like Alka-Seltzer again.
Exactly. Some Alka-Seltzer effervescent formulations can contain hundreds of milligrams of sodium per tablet, sometimes over 500 milligrams. Some effervescent pain relievers are similar, This is truly critical information for anyone on a sodium-restricted diet, perhaps for high blood pressure, or for individuals with heart conditions like congestive heart failure or kidney disease, where excess sodium intake can cause fluid retention and really exacerbate their condition.
Wow, that's a lot of sodium potentially. Definitely need to check the label if you have those conditions. One more.
Let's talk sympathomimetics, basically, decongestants like phenylephrine or pseudoephedrine.
Okay.
You expect them in cold and sinus products, obviously, but they also frequently appear in combination analgesics marketed for sinus pain, like Tylenol Sinus or Advil Cold and Sinus. They might be in some over-the-counter asthma relief products, although those are less common now, and of course in a vast array of general cold, cough, and allergy preparations.
And who needs to be careful with those?
Patients with specific medical conditions really need to use these with extreme caution, or maybe avoid them altogether. This includes people with type 1 diabetes, hypertension, high blood pressure, angina, chest pain from heart disease, hyperthyroidism and overactive thyroid, or certain types of glaucoma or enlarged prostate.
Why? What can the decongestants do?
They can increase blood pressure, raise heart rate, cause anxiety, or worsen thyroid issues. They can significantly exacerbate these underlying conditions.
Okay.
All of this just underscores again and again how fundamentally important it is to diligently read that entire drug facts label every single time you pick up an over-the-counter product. Even for remedies you think you know inside and out, formulations can change.
Absolutely. It's the difference between being just a casual consumer, maybe influenced by advertising, and being a truly informed, expert-level manager of your own health.
That deep understanding of the label and the potential for hidden ingredients leads us directly to some critical principles for product selection. Whether you're a clinician advising a patient, or you're that savvy consumer standing in the pharmacy aisle making a choice for yourself or your family.
Okay. Give us the principles. How do we choose wisely?
First, and maybe most importantly, simplicity is truly key. Whenever possible, try to prefer single-ingredient products.
Why is that better than the combo pills?
Well, while those combination products offer the convenience of treating multiple symptoms with one pill, they often contain, therapeutically effective doses of some ingredients, but potentially subtherapeutic, meaning too low to be effective, or even completely unnecessary doses of others for your specific symptoms.
Right. You might only need the pain reliever, but you're also getting a decongestant and a cough suppressant you don't need.
Exactly. Plus, the different ingredients in a combo product might have different durations of action. One wears off faster than another. And as we've hammered home, you might not even be fully aware of all the active ingredients present, potentially leading to those dangerous cumulative effects or interactions if you take other products.
Okay, so principle 1. Aim for single-ingredient products if possible. What's next?
Second, always ensure that the product you select actually contains a therapeutically effective dose of the ingredient you need for your specific symptom. Check the milligrams for strength. Don't pay for something that isn't strong enough to actually do the job effectively.
Makes sense. Don't undertreat. Principle 3.
Third, and this is a simple but incredibly powerful tip for both your wallet and your health. Always recommend or opt for generic products when they are available.
Ah, the generics. Are they really the same?
By law, generic OTC drugs must contain the same active ingredient in the same strength, dosage form, and route of administration as the brand name counterpart. They are typically equally effective and just as safe, but often at a significantly lower cost.
Why cheaper?
Because the generic manufacturers don't have the massive research and development costs the original brand had, nor do they spend nearly as much on advertising and brand promotion. You're basically paying for the medicine, not the marketing.
Okay, good tip. Use generics when possible. Principle 4.
Fourth, maintain a healthy dose of skepticism when you encounter claims of specific superiority over similar products.
Like works faster or lasts longer.
Exactly, or specially formulated for X type of pain. If a product sounds too good to be true, or if it's making a big fuss about being new and improved, but the active ingredients and their doses listed on the drug facts label are essentially the same as a much cheaper generic, be very wary. Investigate the claim by reading the label.
Don't fall for the hype. Okay. And number 5.
And fifth, especially when selecting products for children, remember that dosage form, and palatability are absolutely crucial considerations.
Right. Kids are just small adults.
Not at all. They can't just take a fraction of an adult pill. They need appropriate liquid formulations or chewables with precise dosing based on their age and weight. Many products come with dosing cups or syringes for accuracy. And frankly, if the medicine tastes terrible, they simply won't take it, rendering the medication useless and your effort pointless. So finding a flavor they tolerate can be key.
All great practical principles for making smarter choices.
Following these really helps you cut through the noise and focus on what matters pharmacologically.
Okay, this next section feels really practical. We're going to dive into the application of all this knowledge we've been building. Let's look at a few common categories of over-the-counter medications and really break down the specific nuances, the critical warnings, and the key considerations you absolutely need to know to master this information, like the pros do.
Exactly. Let's get specific, starting with maybe the most common category. Analgesics and antipyretics. These are our everyday pain and fever relievers.
Okay, where should we start? Acetaminophen.
Let's start with acetaminophen, commonly known by the brand name Tylenol, but available in countless generics and combination products. We've discussed the risks, but let's reiterate the dosing. The maximum recommended adult dose for over-the-counter use is generally considered 3,000 to 3,250 milligrams in any 24-hour period, depending on the specific product label.
Lower than the 4,000 milligram often cited.
Yes, manufacturers and the FDA have moved towards lower recommended daily maximums on OTC labels to build in a greater margin of safety, largely due to the risk of unintentional overdose from combination products. Under direct medical supervision, a healthcare professional might still allow up to 4,000 milligrams in certain situations, but for self-care, stick to the label, usually 3,000 or 3,250 milligram max per day.
Okay, and the critical warning again.
The critical, potentially life-threatening warning, as we saw so vividly with AH, is the risk of severe liver damage. This risk dramatically increases if you consume 3 or more alcoholic drinks daily while taking it, or if you unknowingly take other products also containing acetaminophen, leading to that accidental and dangerous overdose. You must track your total daily intake from all sources.
Message received. Track all sources. Watch the daily limit. Be extremely careful with alcohol. What about the others? Aspirin and NSAIDs.
Okay, then we have aspirin and the other common nonsteroidal anti-inflammatory drugs, or NSAIDs, primarily ibuprofen, found in Advil or Motrin IB, and naproxen, often sold as a Lev. These also come with some very significant warnings.
What are the main ones for NSAIDs?
Generally, they should be avoided or used with extreme caution in patients with a history of gastrointestinal bleeding, like stomach ulcers. Also, caution is needed in individuals with conditions like heart failure, kidney impairment, renal insufficiency, liver impairment, hepatic insufficiency, asthma, as NSAIDs can trigger attacks in some asthmatics, uncontrolled high blood pressure, or other underlying cardiac diseases.
So quite a few conditions where they might be problematic.
Yes, and a profoundly crucial warning we mentioned before. Aspirin specifically should never be given to children or teenagers who are recovering from chickenpox or who have flu-like symptoms. This is due to that increased risk of Reye syndrome.
The Reye syndrome risk is only with aspirin, not ibuprofen or naproxen.
Correct. The Reye syndrome association is specific to aspirin and other salicylates in children and teens with viral illnesses. However, for all NSAIDs, including aspirin, ibuprofen, and naproxen, there's an increased risk of serious gastrointestinal side effects, including bleeding, ulceration, and perforation, a hole of the stomach or intestines. This risk can occur at any time during use and without warning symptoms.
Who is at higher risk for that GI bleeding?
The risk is particularly elevated if you're over 60 years old, if you have a history of peptic ulcer disease, if you're taking blood thinners, anticoagulants like warfarin, corticosteroids like prednisone, or even if you're taking multiple different NSAIDs concurrently, like aspirin plus ibuprofen. Consuming 3 or more alcoholic beverages daily while taking NSAIDs also significantly increases the risk of GI bleeding.
Okay, alcohol is bad with acetaminophen and NSAIDs.
Yes, it increases risks with both, just different risks, liver with acetaminophen, stomach bleeding with NSAIDs. Also, it's important to note that long-term continuous use of ibuprofen or naproxen may also increase the risk of heart attack, myocardial infarction, and stroke. This risk seems to be lower with naproxen compared to some other NSAIDs like ibuprofen or diclofenac, but it's still a consideration, especially for those with underlying heart disease.
A heart risk with common pain relievers.
Yes, it's known as the cardiovascular risk of NSAIDs, and there are warnings about it on the labels now. And one more interaction point. If you happen to be taking low-dose aspirin daily for its cardioprotective effect to help prevent heart attack or stroke.
Yeah, like baby aspirin.
Be aware that frequent or regular use of ibuprofen can actually interfere with and reduce that protective benefit of aspirin. Naproxen doesn't seem to have the same interaction, which is why it might be preferred if you need an NSAID while on daily low-dose aspirin, but always discuss this with your doctor.
Wow, okay. That's a lot to consider just for basic pain relievers. What about that topical one, diclofenac gel?
Right. Topical diclofenac, available as Voltaren gel. It's popular for applying directly to joints for arthritis pain. But remember, even though it's topical, it is still an NSA. Some of it is absorbed into your bloodstream.
So the systemic warnings still apply.
To some extent, yes. The amount absorbed systemically is much lower than taking an oral NSAID, so the risk of systemic side effects like GI bleeding or cardiovascular events is lower but not zero, especially with widespread or long-term use. Therefore, it's crucial to avoid taking oral NSAIDs like ibuprofen or naproxen pills at the same time you're using topical diclofenac to prevent accidentally exceeding safe systemic doses and increasing those side effect risks.
Don't double dip on NSAIDs, basically.
Exactly. Also, be cautious about sun exposure on the areas where you've applied the gel, as diclofenac can increase photosensitivity, making you more prone to sunburn there.
Good tip. Okay, let's switch gears. What about acid reducers for heartburn?
Okay, acid reducers. We have two main types available over the counter now. First, the H2 antagonists, also called H2 blockers. Examples include cimetidine, sold as Tagamet HB, and famotidine, sold as Pepcid AC or Zantac 360.
What are they good for?
These are generally excellent for the relief and prevention of occasional heartburn, may be triggered by certain foods. Warnings for these include avoiding use in children under 12 years old generally, and you should see a doctor if you experience more concerning symptoms like difficulty or pain swallowing food, vomiting with blood, or passing bloody or black stools, as these aren't just simple heartburn.
Right, signs of something more serious.
Yes. Also seek medical attention if your heartburn symptoms are accompanied by lightheadedness, sweating, dizziness, or chest or shoulder pain, as these could potentially indicate a cardiac issue mimicking heartburn. H2 blockers are generally not meant for continuous use longer than 14 days without consulting a doctor.
Okay. Any specific issues with it?
Well, one specific point for cimetidine, Tagamet HB, it's known to inhibit certain liver enzymes and can increase the serum concentrations and potential toxicity of several other medications, including theophylline, used for asthma, warfarin, the blood thinner, and phenytoin, an anti-seizure drug. Famotidine has far fewer significant drug interactions, making it generally preferred. Always check for interactions if you're on other meds.
Good to know famotidine might be safer interaction-wise. What's the other type of acid reducer?
The other main type are the proton pump inhibitors, or PPIs. These are generally more potent acid reducers. Examples now available OTC include esomeprazole, Nexium 24HR, lansoprazole, Prevacid 24HR, and omeprazole, Prilosec OTC. There's also omeprazole combined with sodium bicarbonate, Zegerid OTC.
And what are these ones indicated for?
These are specifically indicated for the treatment of frequent heartburn, which the FDA defines as occurring 2 or more days per week. They are not meant for immediate relief of occasional heartburn.
Why not for immediate relief?
Because they have a delayed onset of action, it can take anywhere from 1 to 4 days for their full acid-reducing effect to become noticeable. So they work by preventing acid production over time, not by neutralizing acid that's already there.
Okay, so H2 blockers for quick relief, PPIs for frequent, ongoing heartburn prevention. Got it. What are the warnings for PPIs?
Warnings include avoiding use in children under 18 years old unless directed by a doctor. Similar concerning GI symptoms, as with H2 blockers, difficulty swallowing, bloody vomit, or stools warrant seeing a doctor. Like H2 antagonists, OTC PPIs are typically intended for a maximum 14-day course of treatment. You can repeat a 14-day course, but usually no more often than every 4 months, unless advised otherwise by your doctor.
And any long-term concerns with PPIs? They seem pretty common.
Yes, this is important. While generally safe for short-term OTC use, long-term prescription PPI therapy has been associated with several potential risks. These include an increased risk of Clostridium difficile-associated diarrhea, which is a serious bacterial gut infection.
See, diff, yeah.
Also an increased risk of pneumonia and potentially an increased risk of bone fractures, particularly of the hip, wrist, or spine, especially with high doses or prolonged use, a year or longer.
Wow, fractures. How does that happen?
The mechanism isn't fully clear, but it's thought that by significantly reducing stomach acid, PPIs might interfere with calcium absorption, potentially weakening bones over time. Also, you should stop using the PPI and see a doctor if you develop a new or unexplained rash or joint pain, as this could rarely indicate the new onset or exacerbation of an autoimmune disorder like lupus.
Okay. Any major interactions with PPIs?
Yes. PPIs can also interact with several important prescription medications. They can decrease the effectiveness of clopidogrel, Plavix, another important blood thinner often used after heart attacks or stents. They can interact with warfarin, certain antifungals like ketoconazole, methotrexate, and others. Again, consultation with a pharmacist or doctor is crucial if you're taking other medications, especially prescription ones.
So much complexity, even in heartburn meds. Okay, let's move to allergy preparations. Antihistamines.
All right, antihistamines. They're broadly categorized into two main generations. You have the first generation antihistamines, the older ones, like chlorpheniramine, clotrimazine, clemistine, Tavist, and particularly diphenhydramine, which most people know from Benadryl.
What's the main thing about those older ones?
The main characteristic is that they are typically much more sedating. They readily cross the blood-brain barrier and affect histamine receptors in the brain, causing drowsiness. Diphenhydramine is, in fact, generally considered the most sedating of the common ones, which is why it's so often used in nighttime cold remedies, and those PM pain relievers and sleep aids we talked about.
Okay, sedation is key. Anything else?
These older antihistamines can also have more significant anticholinergic side effects, things like dry mouth, dry eyes, blurred vision, urinary retention, constipation. And paradoxically, they can sometimes cause excitability or hyperactivity in some children, the opposite of sedation.
Right, the opposite of affecting kids sometimes, so cautions.
Absolutely crucial to avoid combining them with any other sedating substances, other sedating medications, tranquilizers, opioids, muscle relaxants, and definitely alcohol. The combined sedative effect can be dangerous. And obviously, use extreme caution when driving or operating any kind of machinery, as your reaction time and alertness can be significantly impaired.
Okay, what about the newer ones?
Then you have the second generation antihistamines. These are generally preferred for daytime allergy relief because they cause much less sedation. Examples include cetirizine, Zyrtec, fexofenadine, Allegra, levocetirizine, Xyzal, and loratadine, Claritin, Alavert.
Why are they less sedating?
They are designed to be more selective for histamine receptors outside the brain and don't cross the blood-brain barrier as readily as the first-generation ones. So they have minimal anticholinergic side effects and a much lower chance of causing drowsiness, though some people might still experience mild sedation, particularly with cetirizine or levocetirizine at higher doses.
Generally better for staying awake then.
Generally, yes. Much better choices for daytime use when you need to be alert. Always keep in mind, though, that antihistamines, both first and second generation, are frequently included in those combination cold, flu, and sinus products. So always check that drug facts label to see which antihistamine, if any, you might be taking, especially if you're taking more than one product.
Good reminder. Okay, how about decongestants? For stuffy noses.
Decongestants. They help clear up stuffy noses and sinus pressure, and they come in two primary forms available OTC: topical intranasal sprays and systemic oral medications.
Let's start with the sprays.
Okay, topical decongestants like oxymetazoline, found in Afrin, Zicam, intense sinus relief, etc., and phenylephrine, like neosynephrine, nasal sprays. They provide temporary and often pretty immediate relief from nasal congestion by constricting blood vessels in the nasal passages.
Sounds good. What's the catch?
The critical warning here, the one that absolutely cannot be stressed enough, is do not exceed 3 consecutive days of use.
Only 3 days. Why so strict?
To prevent a frustrating condition called rhinitis medicamentosa. This is essentially rebound nasal congestion. If you use the sprays for too long, your nasal passages become dependent on the medication. When you stop using it, the blood vessels dilate excessively, and your congestion actually comes back worse than when you started.
Ah, the rebound effect. So you feel like you need the spray even more.
Exactly. It leads to a vicious cycle of continued use and worsening congestion. So 3 days max, then give your nose a break. You should also use caution with these sprays if you have underlying heart disease, high blood pressure, thyroid disease, or diabetes, as some of the drug can be absorbed systemically and potentially worsen these conditions.
Okay, 3-day rule is key for nasal sprays. What about the pills?
Systemic decongestants, the pills you take by mouth. The main ones currently available OTC are phenylephrine, found in Sudafed PE and many combo products, and pseudoephedrine, found in original Sudafed and others, but kept behind the counter. These relieve sinus and nasal congestion throughout the body.
What are the warnings for the pills?
Warnings include avoiding them if you're taking certain types of older antidepressants called MAO inhibitors, MAOIs, as this combination can lead to a hypertensive crisis, a dangerously high spike in blood pressure. You should also use caution or potentially avoid them if you have pre-existing heart disease, high blood pressure, diabetes, thyroid disease, certain types of glaucoma, or an enlarged prostate, as they can exacerbate these conditions.
What kind of side effects can they cause?
Potential adverse effects include arrhythmias, irregular heartbeats, tachycardia, a fast heart rate, elevated blood pressure, anxiety, nervousness, tremors, and insomnia, especially if taken later in the day.
So they can make you feel jittery and interfere with sleep.
They definitely can. And remember our earlier discussion about pseudoephedrine specifically?
Hmm.
It's federally regulated due to its potential use in illicit methamphetamine manufacture. That's why it's kept behind the pharmacy counter, requires photo ID, and has purchase quantity limits. Phenylephrine, PE, is available on the open shelves, but is generally considered less effective as a decongestant than pseudoephedrine by many experts and consumers.
Right. Good context on the decongestants. How about antidiarrheal agents?
Okay, antidiarrheal agents. Let's focus on the two most common OTC options. First, bismuth subsalicylate, which is the active ingredient in products like Pepto-Bismol and Capectate.
The pink stuff. What are the warnings there?
It comes with several important warnings. You should avoid it if you're already taking other salicylate products like aspirin or if you have a known aspirin allergy. Also avoid it if you have existing bleeding disorders, active peptic ulcer disease, or if you're experiencing bloody or black stools, as these could indicate a serious GI bleed that needs medical attention, not just an antidiarrheal.
And the Rey syndrome risk.
Yes, crucially, like aspirin, bismuth subsalicylate should also be strictly avoided in children or teenagers who are recovering from chickenpox or who have flu-like symptoms, again due to that rare but serious risk of Rey syndrome.
Okay. Any weird side effects?
A harmless but sometimes surprising side effect people should be aware of is that it can cause temporary black discoloration of the stool or the tongue. Doesn't mean anything dangerous, but it can be alarming if you're not expecting it.
Good to know. What's the other main antidiarrheal?
The other main one is loperamide, commonly known by the brand name Imodium AD, but also available generically.
What are the warnings for loperamide?
It should generally be avoided in children under 12 years old unless directed by a doctor, and also shouldn't be used if you have bloody or black stools or a high fever, as these might indicate an invasive bacterial infection where slowing down the bowel could actually be harmful, while typically very safe and effective at the recommended doses. This is where that profound abuse potential we discussed earlier becomes truly life-threatening.
Right, the risk with massive doses.
Yes. A critical boxed warning now exists on loperamide products, highlighting that taking higher than recommended doses, whether intentionally for euphoric effects or to self-treat opioid withdrawal, can cause extremely dangerous heart problems. This includes torsades de pointe, that specific dangerous arrhythmia, and potentially sudden cardiac arrest. So absolutely stick to the recommended dosage on the label.
A very serious warning for misuse. Okay, last category for this section, laxatives.
Laxatives for treating constipation. There are several types. The safest options for chronic regular use if needed are generally the bulk formers. These include ingredients like polycarpophyll, fibricon, psyllium, metamucil, or methylcellulose, citrusol. They work by absorbing water and adding bulk to the stool. Also relatively safe for longer-term use are the stool softeners like docusate sodium colas or docusate calcium. They work by drawing water into the stool to soften it.
Any tips for using the bulk formers?
Yes, if you're using bulk formers like Metamucil, it's absolutely essential to take them with adequate fluid, usually a full glass, 8 ounces of water, or other liquid. This is crucial to prevent the powder from swelling up in the throat or esophagus and causing choking or blockage.
Good safety tip. General warnings for all laxatives.
Yes, general warnings for pretty much all laxatives include using caution and consulting a doctor if you experience a sudden and unexplained change in bowel habits that persists for more than 2 weeks. Or if you have severe abdominal pain, nausea, or vomiting along with the constipation, as these could indicate a bowel obstruction or another serious underlying condition that needs medical evaluation, not just a laxative.
Okay, what about the stronger stimulant laxatives?
Stimulant laxatives like Basacadil, Dulcolax, and Senokot Xlax work by directly stimulating the nerves in the intestines to cause contractions. They are effective for short-term relief but can cause side effects like stomach discomfort, cramping, or rectal burning, especially with Basacadil suppositories.
Are they okay for long-term use?
Generally, stimulant laxatives are not recommended for long-term chronic use without medical supervision. Chronic use can potentially lead to the colon becoming dependent on them, lazy bowel, and can also result in abdominal cramping and significant disturbances in your body's fluid and electrolyte balance, which can be serious.
Right. And you mentioned laxative abuse.
Yes, unfortunately, in some cases, particularly often observed in individuals with eating disorders like anorexia nervosa or bulimia, a condition known as laxative abuse syndrome can develop, involving chronic overuse of laxatives, often stimulants, leading to severe dehydration, electrolyte imbalances, and long-term bowel damage. It highlights both the physiological and potential psychological risks associated with misusing these products.
Wow. Understanding these specific warnings and considerations for each category is truly paramount for safe and genuinely effective self-care. It really elevates your ability to make choices like a seasoned professional would.
Absolutely. Knowing the nuances makes all the difference.
We've delved into quite a few specific examples of how these seemingly simple OTCs can pose real dangers if misused or if the wrong one is chosen. But maybe let's just zoom out for a moment and look at some broader patterns of harm that can arise from treating over-the-counter medications maybe too casually, perhaps not reading that drug facts label carefully enough, or understanding the implications.
Good idea. Some general complications worth highlighting.
One common and really frustrating issue is what we call rebound phenomena. We already discussed rhinitis medicamentosa in detail.
Right. The rebound congestion from overusing nasal decongestant sprays for more than 3 days. Your nose gets hooked, essentially.
Exactly. You stop the spray, the congestion gets worse, trapping you in that cycle of continued use. Another classic example is rebound headaches.
Ah, yes, the medication overuse headache.
Right. This can be triggered by the long-term frequent use of certain analgesics, particularly those combination products containing caffeine, or sometimes butalbital, which is prescription only but illustrates the point, when you use them too often and then try to stop.
Bam. The headache comes back, often worse than before. Your brain gets used to the constant presence of the drug, and when it's suddenly withdrawn, a severe headache often ensues. It's a common problem for chronic migraine sufferers who overuse acute treatments.
So overuse can lead to the very problem you're trying to treat getting worse.
Precisely. It's counterintuitive, but very real.
Okay. What other broad complications?
Then we have the potential for significant gastrointestinal and other organ damage from chronic overuse of certain OTCs. We talked about the liver toxicity with acetaminophen, especially with alcohol.
And the GI bleeding risk with NSAIDs and aspirin, also worse with alcohol.
Exactly. But there are others too. For instance, the long-term chronic use of certain types of antacids, specifically those containing aluminum hydroxide, like some formulations of Maalox or Malanta, can lead to chronic constipation, especially in elderly individuals, and sometimes even fecal impaction. Aluminum can also bind phosphate in the gut, and long-term heavy use could potentially lead to hypophosphatemia, low phosphate levels in the blood, which can cause muscle weakness.
Huh? Didn't know about the antacid risks.
And more broadly, very long-term heavy use of analgesics in general, including acetaminophen, aspirin, and NSAIDs, often in combination has been associated with a type of kidney damage called interstitial nephritis, sometimes leading to chronic kidney disease.
Kidney damage from pain relievers.
Yes, analgesic nephropathy is a known complication of chronic high-dose overuse over many years. These are not minor side effects. They are potentially profound impacts on vital organs from seemingly benign drugs when misused over long periods.
Really underscores the need for appropriate use and respecting dosage limits. What about effects on the brain or nervous system?
Yes, we need to be acutely aware of central nervous system (CNS) effects and potentially dangerous interactions. We mentioned that sympathomimetics, the decongestants, and caffeine, both very common in many OTC products, can cause undesirable CNS stimulation. Insomnia, nervousness, anxiety, restlessness, tremors, especially in sensitive individuals or at higher doses.
Making you feel wired or anxious.
Right. And on the flip side, antihistamines, particularly those sedating first-generation ones like diphenhydramine, cause significant sedation and drowsiness. But the critical danger here is that the sedative effect can be dramatically and dangerously worsened when they are taken concurrently with any other central nervous system depressants.
Like what?
Like prescription sedative hypnotics, sleeping pills like Zolpidem, benzodiazepines, tranquilizers like diazepam or alprazolam, opioid pain medications, muscle relaxants, and of course, alcohol. Combining these can lead to excessive sedation, dizziness, confusion, impaired coordination, slowed breathing, and potentially even coma or death in severe cases.
So never mix sedating antihistamines with alcohol or other downers.
Absolutely never, unless explicitly advised and very carefully monitored by a healthcare professional. And certainly never before driving, operating machinery, or doing anything that requires mental alertness. Your judgment and reaction time will be severely impaired, even if you don't feel overtly sleepy.
These broad complications really drive home the point that OTC doesn't mean risk-free.
Not at all. Respect for the medication, dosage, duration, and potential interactions is just as important as with prescription drugs.
And that brings us to a really crucial special consideration. Our littlest learners, the pediatric population, kids.
Yes, this is incredibly important. The FDA has been putting over-the-counter cough and cold preparations under intense scrutiny for use in children, and for very good reason.
Why the extra scrutiny for kids' cold meds?
Primarily because there's a significant lack of robust efficacy data, meaning solid scientific evidence that these products actually work effectively to relieve cold symptoms, specifically in children under 12 years of age. Much of the dosing was historically extrapolated from adult data.
So we don't even know for sure if they help much in young kids.
There's limited evidence for significant benefit, particularly for the cough suppressants and decongestants in very young children. And perhaps more disturbingly, there have been numerous reports over the years of serious and potentially life-threatening toxicity in very young children, particularly infants and toddlers, associated with accidental overdose or misuse of these products.
Toxicity from kids' cold medicine.
Yes. Young children are much more sensitive to the effects and side effects of these medications, and dosing errors are easier to make with liquid formulations and small body weights.
This feels like an absolutely critical takeaway for every parent, grandparent, or caregiver listening right now.
It absolutely is. Based on the lack of proven efficacy and the documented safety concerns, the FDA now strongly recommends that over-the-counter cough and cold agents, and this specifically refers to products containing anticussives like dextromethorphan, expectorants like guaifenesin, decongestants like phenylephrine, and antihistamines like diphenhydramine or chlorpheniramine should not be used in infants and children younger than 2 years old, period.
Not be used at all underage, too.
Correct. The risks in this highly vulnerable age group are considered to outweigh any potential unproven benefits.
What kind of risks are we talking about? What happened in those toxicity reports?
There have been documented cases of severe and potentially life-threatening adverse events associated with accidental overdose or improper use in this very young age group. These include dangerous arrhythmias or irregular heartbeats, frightening hallucinations, seizures, and encephalopathy, which is a serious condition involving brain dysfunction.
These aren't just minor side effects like a little drowsiness. These are severe, potentially fatal complications.
Exactly. Severe complications that can put a child's life at grave risk. It's a powerful, sobering reminder that over-the-counter does not, and absolutely should not, be interpreted as without risk, especially when it comes to the most vulnerable members of our population, our infants and toddlers.
Truly understanding this distinction, this specific warning for kids under 2, isn't just helpful advice. It could literally be a life-saving piece of knowledge for parents.
Absolutely essential. Always consult a pediatrician or pharmacist before giving any medication to a very young child.
So, as we bring this really detailed deep dive into the complex, often hidden world of over-the-counter medications to a close, what's our ultimate unifying takeaway here? What's the main message we want people to leave with?
Well, I think this deep dive truly raises an important question for all of us, doesn't it? How can we bridge that gap between the incredible ease of access to these products at everywhere and the critical need for truly informed decision-making?
Right. Access versus understanding.
Exactly. And the power ultimately truly lies in your hands, the consumer. Knowing these intricate details we've discussed, diligently understanding the warnings on the label, and meticulously scrutinizing those drug facts labels every single time, that knowledge can quite literally be life-saving, as we saw with the case study.
It's about shifting from passive acceptance to active engagement.
Perfectly said. The goal isn't to be overwhelmed or intimidated by the sheer volume of choices in that pharmacy aisle. It's to be profoundly empowered by the knowledge we've shared today. It's about becoming an active, informed, and truly expert-level participant in your own healthcare journey, even when you're just picking up a common cold remedy or a pain reliever from a pharmacy shelf.
We've definitely navigated the complex world of over-the-counter medications today. We've dissected everything from, the clever marketing tricks that try to sway our choices and the rigorous regulatory shifts that allow these products onto the shelves in the first place. right down to the specific dangers posed by hidden ingredients and those crucial interactions. And we've covered the essential guidelines for safe, informed use.
Yeah, we covered a lot of ground.
Hopefully, you now have a comprehensive framework for understanding not just what these medications do, but why certain precautions, certain warnings are absolutely critical. You have the knowledge now to recognize those hidden ingredients, to understand cumulative risks, and hopefully that transforms you from maybe a casual buyer into a truly savvy, expert consumer when it comes to OTCs.
And with that enhanced understanding, maybe consider this final thought. How profoundly might understanding these hidden risks, these complex interactions, these specific warnings for common over-the-counter medications, how might that change your perspective on all medications you encounter, even those prescriptions you've used seemingly without a second thought for years?
Good question.
What new critical questions will you ask yourself, your pharmacist, or your doctor the next time you or a loved one reaches for an over-the-counter remedy, or even fills a prescription? That moment of conscious inquiry, that pause to ask, what's really in this? What are the risks for me? That's where true mastery of your own health begins.
That's a great provocative thought to leave people with. And for those of you listening who really want to delve even deeper, to continue mastering this information and become even more expert, comprehensive resources are readily available, aren't they?
Oh, absolutely. For healthcare professionals and even motivated consumers, the Handbook of Non-Prescription Drugs, published by the American Pharmacists Association, is widely considered the most comprehensive and authoritative resource specifically for over-the-counter medications available today. It goes into incredible detail.
Okay, the Handbook of Non-Prescription Drugs. What else?
There's also Facts and Comparisons e-Answers, which is an excellent online subscription reference for all kinds of drug information, including OTCs. And of course, there are reliable FDA resources on their website, fda.gov, and DailyMed, dailymed.nlm.nith.gov, which is run by the National Library of Medicine and provides the official FDA-approved labeling information, including the drug facts, for thousands of marketed drugs, both prescription and OTC.
So plenty of places to look for reliable, detailed information if you want to go further.
Definitely. Being a truly informed and expert consumer means consistently seeking out, evaluating, and utilizing reliable information sources like these. It's an ongoing process.
Fantastic. Well, this has been an incredibly informative deep dive. Thank you.
My pleasure. It's critical information to share.